welcome back to Ion South Florida. Today we are talking about digitizing your medical records and keeping them on your iPhone, on a bracelet, on your wrist. This is so interesting. Kevin Hauser, he is the CEO of Medefile. We have Scott Kamak, who is a private registered nurse, and Lily Albahassan, who is a patient and also a client of Medefile. So you were just mentioning, Scott, that when people come into the emergency room, they really can't think about what their medical history is, and a lot of times their family doesn't really know either.
They don't. I mean, so many times when a patient comes in, you're trying to get as much information from them as possible, and you'll ask for the husband. You'll say, "Well, what medications do you take?" Well, my wife puts out a white pill and it's a blue pill, but it's about this big, and it's got like a number on it. What's it for? I don't know. I don't know. So you're just taking what your wife puts out in front of you. Well, basically. So if for some reason, if the wife's not there, do you take the pills? Well, no. What is it for? Well, I think that one's for blood pressure. I'm not sure.
So there's a lot of confusion.
It is a lot of confusion. And the thing is, you're trying to get as much information from these patients as quickly as you can, and you just don't understand that when you come in there, this can have the determination on if you're going to walk when you leave, if you're going to have any neuro deficits, if you're going to carry on a conversation, or if you're going to be in a long-term care facility. If you have that information there, that is golden, and that's everything you need. And this, when you can show it to them, you can be concentrating on the loved one that's laying there, but if you can go ahead and say, this is everything right there, and they can plug it in or they can scan down, I mean, you're way ahead of the game, way ahead of the game.
And this bracelet, basically, that you wear around your wrist, Kevin, show that to us. This is a USB.
It's
you just
USB
plug it
port.
into a USB port. And
plug it into any Windows-based PC. It'll automatically load that person's emergency medical information. So your current medications, your allergies, your medical history, really designed from a paramedic's run report so that if you couldn't speak, then this is designed to speak for you in that emergency situation.
And this can hold digital images, MRIs, CAT scans, anything that you've had done.
Anything and everything. It is designed to basically be a mirror image of any and all of your file that we've gone out and gathered on your behalf.
And can you also type up maybe a personal history and put it on there as well, like your previous, because a lot of stuff is not in medical records.
Absolutely. Within our system, not only do we collect the records, but there's a lot of other benefits and features that we offer, including a diary journal, so that you can keep track of whether it's diet, exercise, personal data, as well as keeping all the healthcare measurements like your blood pressure, blood sugar levels, body mass, including a healthcare calendar to help you keep up to date with all of your appointments and setting appointments and a reminder for it. So there's a lot more than just the actual medical records that is encompassed in a personal health record. It's really used to help promote proactivity and to get individuals really more focused in their own health care. Because if they're not going to be the #1 advocate for themselves, no one's going to be as good of an advocate, except for themselves as well.
Lily, you had said from a legal standpoint, because you're a legal assistant, why is this important?
Well, when you go into a hospital, usually they ask you, do you have a living will? Do you have any chronic conditions? Do you have a healthcare surrogate? Do you have a durable power of attorney? Do you have power of attorney? And these are important things that I have put in Medefile through the MediVault. They're vaulted documents that are essentially very important to your health, especially when you are not able to speak for yourself. And I don't know if you saw, probably a few months ago on one of these 60-minute shows, the cost and end of dying, because most people just don't know. If they have a DNR, if they have a living will, who's the healthcare surrogate, who makes the decisions for you. I worked in estate planning and transactional law, but I do realize that the importance of having these documents accessible to you rather than waiting for the firm to open up to be able to go into the actual safe and pull your records is essential.
And so you can put all of that on there.
Anything and everything, even your financial documents, identification documents,
Life insurance.
everything and anything that you could imagine. Either it's a standardized folder set up for you, or you can just create folders on the fly within the vital documents area. And one other thing that I wanted to mention, Suzanne, is, you know, we here in the United States are very slow to adopt electronic medical records for doctors. Still to date, I think the statistics only about 82% of physicians' practices have gone electronic.
Yeah, I mean, they're still writing out on there.
Absolutely.
It's crazy
and
to
the
me.
point is, you know, here, being in South Florida, we are subject to some natural disasters. So hurricanes, when we look back a few years ago, we had Wilma, and that destroyed a lot of individuals, whether it was their or offices. Well, unfortunately, we also lost power for a good, I certainly know where I lived, close to 2 weeks' time. And all my doctors were already traveling to Tampa, Orlando, where there was power. If, God forbid, there was an issue with me and my health, there's no way that I was getting in touch with my doctor. And even if I did, if he didn't have my chart with him, there was no information that he had. So by having that, we now take that responsibility upon ourselves to have any and all of that information that's needed, regardless of where and when. And that's really what it's about.
Why do you think doctors have been so slow to digitize medical records, Scott?
I just think that, for one thing, it's a lot of times they get used to, you know, writing out everything, and then if they write it out, they know what they're writing. But the thing is, and I know a lot of people, when they get discharge instructions, if the doctor writes something or whatever, they can't read it.
Yeah.
And then they're like, so then they're not even really sure what it is, and everybody makes jokes on, well, that, you know, doctors just have, but you
Bad handwriting.
they write so much that a lot of times you don't really know, and it just looks like a line or something, so you don't even know what the words are. And what Lily was saying too about having like your DNR status, do not resuscitate. People don't understand that when you come into a situation, if it's critical and you're by yourself and you don't have anyone to go ahead and speak for you, or you're not able to go ahead and give them a Medefile, you know, anything like that.
Their wishes.
Once a patient is put on a ventilator, and they said that they wanted to be a do not resuscitate, it almost takes like an act of Congress for that hospital to get that patient off, because if they take that patient off the ventilator and that patient dies, then
They're liable.
Well, because they're going to think that, are they going to come back and sue us?
Yeah.
And it's not fair, because, you know, if this is their wishes, that they don't want to have a feeding tube, they don't want to have a ventilator, they want to have just what they have down there. That's it. And once you put that in, they're going to go ahead and say, well, we thought it was just for a short time. Well, you don't know. And you don't know what other circumstances the patient could have had clots, the patient could have had an aneurysm before. You don't know what the patient had. This allows you everything, and it shows what their wishes are, because, like I say, I've worked with nurses before that actually had, and it was a joke, but they had DNR tattooed on their chest. A small one. It was a joke, because they always said, well, when they open up and they're getting ready to go ahead and shock me, I want them to be able to go ahead and see it. And it seems, you know, the other nurses used to joke around with it, but they wanted to know that they didn't want to go ahead and if they drowned and they were underwater for a long period of time, what's your quality of life when you come back? It's quantity of life versus quality of life.
And this allows people to know exactly how you feel.
Exactly.
All right, coming back, I want to talk about the privacy issues, because I'm sure that you all take that very seriously, but people want to know. And let's talk about how specifically you get your documents. Do you all do that? Do I have to do that? And also, you have a personal experience about how Medefile helped you, so we're going to talk about that all when we come back here on Eye on South Florida. Stay with us.